60 American lives are taken every single year due to hurricanes. Furthermore, the Congressional Budget Office estimates that 1.2 million American lives in coastal areas are at risk of substantial damage from hurricanes. Chances are you may know one of these 1.2 million people. This all leads to the crisis of hurricanes on public health. These hurricanes also pose a serious threat to public health. As seen in this graphic here by the U.S. Climate Change Research Program, they report that hurricanes result in the loss of $392 billion in the U.S. alone. Climate change is only exacerbating the problem. Increasingly warm temperature averages can result in more powerful hurricanes because hotspots and warmer average water temperatures add more energy to each hurricane. Human health is also drastically impacted by these hurricanes. When these coastal regions get hit with these storm surges, it can result in towns being completely covered in water. This also increases the criminality of contaminated water. The impact of hurricanes on flooding is very clear. During Hurricane Harvey, Texas gained more than 50 inches of rainfall in some areas. This is 40% more than what was expected. Mosquitoes also thrive in these wet conditions because they need to breed in standing water. Mosquito bites can transmit diseases such as malaria, West Nile virus, which can have immense effects on human health. Possible danger can come from power outages. If the power goes out in a place such as a hospital, many lives could be put at risk, as they could be on life support, bypass machines, or even something as simple as lighting during a surgery. High winds and intense rain can also jeopardize the structure of the hospital, and if this occurs, many people could become trapped. An example of this can be seen in the wreckage in Panama City. If there were questions with regard to the structural integrity of a hospital prior to or during a hurricane, it could result in the need to evacuate. In the wake of such an event, many shelters open for people in need. These shelters are often cramped, and many people are forced to stay in extremely close quarters. This is the perfect breeding ground for disease and could result in mass outbreaks. Lastly, even after the hurricane is over and the floods have subsided, there are still many human health effects, one of these being mold. When water gets into homes and is left untreated, mold starts to grow, exacerbating health problems such as asthma and causing new problems such as pneumonia, allergic reactions, and coughing and wheezing. These symptoms can be even worse in children, the elderly, and immunocompromised individuals. This effect on public health is not just physical. There is also a strong mental component. According to Gentry, a New Orleans news source, what we found through surveys is that even if we had 100% of the people evacuated from nursing home facilities and hospitals, within 8 weeks, we usually saw a 10% fatality rate. This 10% was due just from the stress that results from evacuation and moving, nothing more. Hurricanes can also have continued effects even after they've passed. PTSD, anxiety, depression, and even an increase in suicidal thoughts are common. One study was also able to show how PTSD rates in Alabama, Louisiana, and Mississippi rose from 15 to 21%, and suicidal thoughts increased from 2.8% to 6.4% after Hurricane Katrina and Sandy. In the chaotic aftermath of the storm in Puerto Rico, calls from desperate residents to suicide prevention hotlines doubled. Additionally, suicide rates reached a new high after years of steady drops. By the close of 2017, just 5 months after the hurricane, the island's suicide rate had increased 29% compared to the previous year. Additionally, a rapid needs assessment of returning New Orleans residents after they were hit with Hurricane Katrina back in 2005 was conducted by the Center for Disease Control and Prevention back in October 2005. This survey revealed that more than 50% of respondents showed signs of a possible need for mental health treatment. Though we cannot stop hurricanes, there are solutions to mitigate their impacts. One strategy is to limit the amount of impervious surfaces that prevent rainwater from being absorbed instead of running off and collecting, which is a major issue in cities, resulting in flooding. One idea recently proposed by Bill Gates and the British marine engineer Stephen Salter involves preventing warm water needed to form hurricanes from pooling. This will be done by floating thousands of tire-like rings that will be connected to giant tubes. They will then be able to suck warm surface waters down into deeper, cooler water, thus preventing conditions optimal for hurricanes to form. In our professional opinion, we feel the best way to help solve this problem of hurricanes' effects on public health is to try to decrease our reliance on fossil fuels and really help to try to reverse the effects of climate change. The major reason for this increase in intensity for hurricanes is because we are warming our planet, and that is the only way we will truly be able to solve the issue.